As mentioned earlier, research shows that women with continuous effective support in labour and birth are more likely to have a vaginal birth, have less use of medical pain relief, and describe a more positive experience. However, there may be situations when intervention is required to support the pregnancy, labour and birth. Using the BRAIN acronym and having conversations with your healthcare team can also help you with decision making. Let's take a look at the induction of labour.
Induction of labour is a procedure used to stimulate uterine contractions before labour begins on its own. The most common reason for this is being 10 days overdue. However, this might need to be done earlier for the mother or baby's well-being. For example, if the mother has high blood pressure, diabetes or any other medical condition in the pregnancy, or there are concerns about the baby's size. When an induction of labour is booked for you, you'll be given instructions on where and when to come into hospital. When you're admitted for your induction of labour, you'll stay here until the baby's born, so it's best to bring everything with you. As with all your other visits, it's important to ask a midwife or doctor any questions that you might have, and this is a really good opportunity to discuss pain relief options for your labour. Before any induction process, the baby's heart rate is monitored over 20 minutes, and if any medication is given or procedure is done, this will usually be repeated. Then, during labour, the baby's heart rate will be continuously monitored. The cervix is the opening of the uterus and is at the top of the vagina. It usually starts out 3 to 4 centimetres long, is firm and it's closed. During labour, the cervix will soften, thin out and open or dilate. The cervix is 10 centimetres dilated at full dilatation. If the cervix is not quite ready for labour, either a thin plastic tube is placed inside the cervix or a gel is given into the vagina. This helps the cervix to soften, thin out and open up enough so that the waters can be broken. For the waters to be broken, an internal vaginal examination is done by either the doctor or the midwife. The cervix needs to be 1 to 2 centimetres dilated for this to happen. A small hook is used to create a hole in the sac around the baby to release the fluid from around the baby. This is sometimes called an ARM or artificial rupture of the membranes. Once the membranes have been ruptured, it is sometimes necessary to stimulate uterine contractions with a hormone called oxytocin. This is a synthetic hormone which is similar to one your body makes to go into labour. This is given through an intravenous drip into the bloodstream. The induction process may take place over 1 or more days, depending on how ready your body is for labour. Every woman and every labour is different.
A medically induced labour will usually make the labour start more quickly and become more intense. Synthetic oxytocin does not have the same benefits to the birthing woman or to the baby as natural oxytocin. The use of medical pain relief options is statistically higher and assisted births are more common with a medical induction. Let's talk about assisted birth. An assisted birth may include the use of forceps, vacuum or Ceasarean section. One of these may be advised if your labour is not progressing or you or your baby start showing signs of medical distress. Depending on the reason and the stage of labour, an obstetrician will advise which method is most suitable. For example, if a woman is fully dilated but having difficulty birthing the baby, then a vacuum or forceps birth may be advised. Whereas if she is not fully dilated, a Ceasarean birth may be advised. A vacuum or ventouse birth can only happen if the cervix is fully dilated. During a vacuum birth, an obstetrician performs a vaginal examination to apply a small vacuum cap to the baby's head. During a contraction while the birthing woman pushes, the doctor will use the vacuum to assist the baby's head to be birthed. A red swollen area may form on the baby's head and may take several days to resolve. The birthing woman may require an episiotomy, a cut made at the opening of the vagina into the perineal muscle. A local anaesthetic is usually applied to the area. A forceps birth can only happen if the cervix is fully dilated. During a forceps birth, an obstetrician performs a vaginal examination to apply 2 forceps, one on either side of the baby's head. During a contraction, while the birthing woman pushes, the doctor assists the baby's head to be birthed. Most babies will develop temporary red marks on their face or head from the forceps. an episiotomy is usually required with a forceps birth. If so, a local anaesthetic is usually provided to the area and the cut will be stitched after the birth of the baby. Caesarean births are either elective, where, because of reasons established during pregnancy, a date and time is planned for the birth, or an emergency, where if once labour has started, the baby needs to be born via surgery. A caesarean is a surgical procedure done in an operating theatre to birth the baby via a cut into the lower abdomen. This is done by an obstetrician with an epidural spinal anaesthetic. This allows the woman to be awake for the birth and supported by her partner or support person. A screen is used so the operation is not visible to the woman and her partner. It may take 10 to 15 minutes before the baby is born. However, the actual surgery may take about an hour. There will be another 30 plus minutes in recovery after the surgery is completed. Where possible, a midwife will stay with the woman throughout the birth and in recovery to assist with skin-to-skin contact and baby's first breastfeed.